So this one started in 2014, but I must say here, this was a renewal of a partnership that exists between Ireland and Mozambique since 1996. But this one represents a new era in terms of, moving ahead in terms of our partnership. And here, particular is how the health staff of Ireland also could collaborate with health staff in Mozambique. So this was really a renewal of that partnership, and I would like to highlight at this stage. And the second thing is that we were all, taken by the belief that we could do something together. And then, we could see that everybody was, challenging by the situation that we can do something to improve quality of services in Mozambique. So we went through to develop this partnership, Minister of Health, Ireland, and then having a mission in Mozambique. This was really created a space and then an opportunity to do something. Now, this initiative fit very well within the health sector strategic plan, especially on one of the second objective was to improve the quality of services, and also in terms of improving the partnership among within the health sector in Mozambique. So you can highlight those two sections. But also we're believing that we could apply a theory of change, as was mentioned here, and try to, not knowing that innovative and practical and improved practices can also improve management, but also have some links with, an overall health system that we can, achieve sustainable development goal. So we went through, but a very practical model of building capacity in quality improvement. So we share experience from Mozambique, from Ireland, collaboration with International Society for Quality Improvement, and also training, a number of teams from different hospitals in Mozambique. You can see some of the team there. What we did, we start with, exchange visits. This took a bit of time. In 2014, there were exchange team from Mozambique, from Ireland. It was confirmed in Mozambique as well. We did ongoing communication, and here it's really important, relevant. The communication between Ireland and Mozambique is too far. We have a certain distance, but this was really important. So we did a number of workshops, as you could see at the beginning of the workshop. We need to break ice, we need to interact, we need to create the spirit of working as a team. And then, as you could see, some of the pictures there. And then working jointly with, people from different angles, the medical doctors. We work as a team, medical doctors, nurses, administrators, to really design. So here are just some practical examples of what people have been focusing. And then we try to focus the attention on the local needs, to try to meet their needs and try to adapt the knowledge that exists between Ireland and Mozambique. And this is in Nampula Hospital, try to improve record keeping in one of the medicine wards in Nampula. Some in the Manisa district, they have defined their own specific objective. And then here is a psychiatric hospital. They were trying to reduce the number of patients who are escaping from hospital. And Jose Macam, they're trying to reduce the intra-hospital mortality. So I'm just bringing this as an example of the really practical way which we design, using the methodology and that exists in the also too. And the Jose Macam particular case, it was really important because we had to search a little bit and use models from Australia. And then we translated the model from Australia just to adapt to their local context. So I just brought this one as really a practical example of how that to do. And the team did the translation directly themselves, and then we had just to make the printing for them and support them. And has this worked? Of course, has been work. We have been seeing some results. I will going through that, but here I just want to mention that we're still at the beginning of the journey. It's not yet done. We are on the beginning of the journey. We have seen some results coming up. I just want to show you one result. This is from Lishinga, where a number of stillbirths were in the beginning were very high, and now they start reducing those number of stillbirth in the hospital. So this is just a really practical example of we are still in the beginning, but we can see some results. Question will be why this has worked. We might have a number of ingredients that this support. I've heard during the first presentation some of the ingredients, respect, no harm, look at the local context, adaptability, we need to adapt to local context. The issue about sustainability, we should do it from the start. making it relevant to the local context, making it relevant to the institution. So this was really some of the ingredients. But as you could see from the first slide, I think political commitment really from the start was really key. A local ownership for the government of Mozambique, this was also important. Communication was key. But above all, I think the role played by different donors, different actors in the context. So in terms of future partnership, I think it will be important to mention here that we still look at how we could continue to develop this partnership, especially on the developing national quality framework and ongoing engagement with local organizations, and also looking at new areas of training and partnership. In conclusion, I must want to say just that this it just shows an example that the partnership, it is in our hands. We can do it. So thank you very much.